Hello, everyone. Thank you so much for joining us today. I appreciate everyone. Today, we're going to talk with a very important panel and discuss the disproportionate impact of COVID-19 on communities of color. COVID-19 has disproportionately affected Latino, Black, and underserved communities. These trends are real in my district and around the nation. As of now, more than 3.46 million people in California have been diagnosed with COVID-19, with more than 45,000 deaths. In San Diego County, more than 248,000 people have been diagnosed. In Imperial County, more than 26,000 people have been diagnosed. Today, we have an amazing panel of community health experts and leaders who are extremely knowledgeable on COVID-19 and public health resources. I'm going to just name them, and I'm going to ask them to introduce themselves. We have with us today Dr. Gregory Talavera, we have Dr. Hector González, and we have Socorro De La Torre. Why don't we start with you, Socorro, and you can introduce yourself, and then the other panelists can introduce themselves.
Okay, thank you for having me here. My name is Socorro De La Torre. I'm a social worker in Imperial County, and I'm also a volunteer for the Alzheimer's Association.
Thank you. Dr. Hector González.
Yes, it's a pleasure to be here with you, Congressman. My name is Hector González. I'm a professor of neurosciences in the School of Medicine at UC San Diego. And my work is primarily in Alzheimer's disease among Latinos in the community.
Thank you very much. And Dr. Gregory Talavera.
I wear two hats. I'm a professor in the Department of Psychology at San Diego State University, but today I am representing San Ysidro Health as a member of the San Diego Latino Health Coalition, and I'll be talking about the work that they're doing in the community relative to COVID-19.
Well, Dr. Talavera, since you were last, I'm going to probably go to you first then.
Okay.
Why and what is COVID-19 disproportionate impact on communities of color telling us? I mean, we see that that's absolutely clear, that there's no doubt about it, that communities of color are impacted more than any other communities. Yeah. What does that tell us?
Well, I think there's a couple of factors. I think knowledge of the virus, and I think also just the general background and culture of our population. David Hayes Bautista wrote a column a week or so ago, and what he highlights is that Latinos are very hardworking, and they work in the lower income jobs in our communities, and they have very large families. So one of the postulates is the fact that because we're working on the front line in service industry and in the hotels and other areas like that where you come in contact more with people, it's not as easy to work from home, and therefore their exposure is greater in the community because generally that is the nature of our culture. The other aspect of the culture is that we tend to live in large families. We have large families and we have extended families. And it makes it hard to social distance when you're in a small room and you have a lot of family members, multi-generational families. Mm-hmm. It makes it difficult to social distance and stay safe. So those are some of the reasons from a cultural perspective. But I also think that, as you well know, that Latinos have one of the highest rates of not being insured for health. And lack of access to information and doctors, I think, is also contributing to the higher rates that we see across the country, and particularly our county here in San Diego.
You know, it's interesting. One of the things that I always hear, about our community is that, we're not that essential. I think this has proved our community's very, very essential. Dr. González, would you like to add anything?
Well, I think Dr. Talavera has done a really fine job summarizing what are some of the major factors affecting our community and the disproportionate impact of COVID-19 on our community. I would also like to echo what you just said, Congressman, is that the Latino workforce are now deemed essential. And as such, as essential workers, frontline workers, I think it's incumbent on the society, greater society, to ensure that we have the proper protections, the PPEs, as you often hear about. And so, as Dr. Talavera was alluding to, is that essential frontline workers that are not getting the PPEs that are really required and essential for being those frontline workers to effectively keep our economy going strong. We've seen some very nice economic growth in the nation. However, we can't, I think it's essential that we provide our essential workers, our community, the type of protections that are needed. Healthcare access is another major point that Dr. Talavera raised, that health insurance rates have improved greatly since the passing of the Affordable Care Act, and I expect those healthcare insurance rates to continue to increase. However, the actual awareness and knowledge of the disease, and maybe some misconceptions in the community about the disease and how it's transmitted, I think we have a large task ahead of us to make sure that everyone's informed. And I think a panel like this is one step, or just another step, towards ensuring that our communities are well informed and that others are aware of the needs of the community.
Well, I think that's a great stepping stone to ask then, Socorro De La Torre. Obviously, you're a social worker in Imperial County, and the condition there has been severe. How do you see it then? Do you see it very similarly?
Yes, definitely. It's very similar. What's going on in the nation, as previously stated, we have a high poverty level here in Imperial County, and that definitely impacts the services that our families here can access. And as I can say.
I mean, it is interesting, that one of the things that have been said, that literally our community is dying to feed America. It literally is in Imperial County. I mean, that's the truth. I mean, sadly. I've seen it there, and I've also seen, interestingly, people who have significant age now still working in the field.
Exactly.
And it's a very difficult. But I guess another question was, okay, so there is this inequity. There's this public health inequity, and why should that matter to our community? I mean, I think it's obvious, but why should Dr. González? Why should we care about this inequity?
I think Greg touched on it, that we have a lot of family connectedness. We're in larger households, and I think as a public health person, the numbers don't tell the story, the rest of the story, the tragic stories of loss, of dinner tables without occupants there any longer. I think it really does matter, and especially to our community. It's been a tragic loss, and if we need to get down to some brass tacks, I suppose, from the economic level, is that I think you summarized it perfectly, is that our community is feeding the American population, the greater population at large. And so in order to keep that economic growth, we need to protect the people that do the work that keeps the economic engine going.
So, Ms. De La Torre, how do you see it? I mean, I know that you're also on the board member of the Alzheimer's Association. I know you're also working with all sorts of groups. I mean, this must ring true for you too in Imperial County.
Oh, yes. We see it all the time. I mean, our workers, a vast majority of our Latinos do work in the fields. They're highly impacted by that. There's no social distances. The safeguards that they can apply or have access to are working in the field. As you drive around the streets, the roads, and you see the workers, they're working pretty close to each other. Whatever precautions they can take, it's limited to what their environment and their working requirements allow. So there's definitely the stressors coming there from our employees. The high, we do have also a very high unemployment rate, and that also affects the ability for many of our constituents to be able to seek out medical services, be eligible for medical services, and help those within their family, even obtaining the basics, which would be the PPE, the masks, or the protective gear that they require. And the loss, definitely, we've had, like you said, we've had many deaths in Imperial County. I believe it's over 600 now. And it's impacting every single one of us. We know of somebody who has passed away in some sense due to COVID.
And I've been through the ICUs there in the hospital and the regional medical center, and I've seen it. I mean, I've seen it, and it's tragic. I mean, I could, in fact, I was there when person was literally had his last breaths, and it was sad because he came from a large family, and no one was there because they couldn't be. Obviously, it was just horribly tragic. Dr. Talavera, from a public health perspective, in terms of this inequity, what would you say? I mean, I see it as great inequity.
Yeah. Well, I think that, the inequities are becoming more clear, like you mentioned. The lack of access to care is one of the causes that we have high hospitalization rates and high death rates, because without access to early care in the early part of your illness, it creates an inequity that way, because you can't have the opportunity to be seen and treated and cared for before the disease gets too far along. The other equity that I'd like to talk about has to do with the vaccine initiative too. We have vaccines available, but again, Latinos have one of the lowest rates of vaccination. And that's because we have an issue of lack of knowledge coming from credible sources. And that's one of the goals of the San Diego Latino Health Coalition, trying to bridge that gap and provide that credible source of information about testing and about this very interesting concept called herd immunity. A lot of people that I talk to in the community are very reluctant to get the vaccine because they have fears of its long-term effects, the history of abuse in minority communities with vaccines. But we're never going to achieve, a safe return to close to normal life unless we get 70% or more of the community vaccinated. And if we have communities of color that are reluctant to join in the vaccination process because of misconception, because of misinformation and cultural beliefs, we really are going to be seeing a worse impact again on our underserved communities, like the Latino community. So that's one of the goals of the coalition. They've been using and deploying promotoras trained in COVID information to inform the community about testing and hospitalization and vaccines. And then lastly, I wanted to bring up an issue that Dr. González and I wanted to talk a little bit more is about how this inequity impacts individuals with chronic disease and multiple chronic diseases. I know from treating diabetic patients, that's my area of interest, that these individuals are struggling with the pandemic to be able to go into the doctor and get their care and to get the treatment that they really need, because again, they're fearful of going into a medical facility where they think they might get exposed. And then Dr. González can talk a little bit more about this. We have individuals in the hospital who are not able to be seen by their family members, who have dementias and things like that. And that's a tragic circumstance too, without being able to have your family surround you when you're ill. So I don't know if Dr. González would like to speak to that a little bit more.
Yeah, please do. Dr. González.
Thank you, Congressman. And I'm really sorry to hear that when you're visiting the AA hospital in Imperial County that you witnessed the death of one of your constituents. It's very tragic indeed, and something not to be glossed over by any stretch of the imagination. I'm not saying that you are, but I think Greg touched on a couple points here. Is that if you are, I think a lot of people in our community, I think among people who are over age 50, over half of our Latino population are diabetic or have some other chronic health condition, diabetes and hypertension being the most prevalent. If you do have diabetes, and I know many of your constituents have diabetes and other medical comorbidities, is that you're 12 times more likely to be hospitalized, and your risk of death goes up 6 times if you're diabetic or have some of these other medical conditions, and that are so endemic in our population. And so it just screams out the need for better protection, to very much take seriously the CDC guidelines. Wearing a mask will make a difference. A good mask will make a difference. The physical distancing is also quite essential. And something that I've been very troubled by is some of the medical reports showing that people who pass away from COVID infection, some of the changes we see in the body, and in particular the brain. And as I mentioned at the beginning, is my area of expertise is in Alzheimer's disease and related dementias. And so brain is also affected, lungs, heart. I mean, every tissue in the system seems to be affected by COVID, the infection. And so the question I've been asking is, well, will we see, or will we expect to see increases in rates of dementia? And I venture to guess that yes, of course. And in fact, the question is how much? And if that's not another good reason to take precautions, I think that's enough for me. And I do want to just reiterate, wearing a mask, taking some of these precautions are essential for your health and for your life and for the life of the people you love.
Thank you. I do want to focus on one issue though that came up that Dr. Talavera you talked about. It's been interesting. One of the when you're in this job, you hear lots of things from your constituents. You try to keep in contact with them, but one of the things I keep hearing is, "¿Dónde está mi vaccination? ¿Dónde me voy a vacunar?" I mean, they haven't been saying, "I don't want to," because I'm afraid. They also, where can I get mine? When is it my turn? I don't know, Socorro. Have you seen that? I certainly have seen that. There hasn't been so much the reluctance that I expected. It's more like, where can I get mine? Why can't I get mine?
Yeah, I've heard that, and this is across the board. But typically, what I've seen from the people I work with and around the community, people do have a lot of misinformation about the vaccine, and they are reluctant to some degree about receiving it. They fear the long-term effects that the vaccine could possibly have. There's mentions, I've heard conversations about people saying that it interferes with your DNA, and then you'll inherit it down the line to somebody else. Those are some of the concerns I've heard about. The other concern is about families not being able to vaccinate their elderly, especially their loved ones who are diagnosed with dementia or Alzheimer's, and they fear even going out to the doctor and being exposed to somebody who may be even in the waiting room to see the doctor, that they could possibly be infected themselves. And because with the dementia and the behaviors and the memory loss, a lot of our loved ones with dementia and Alzheimer's, they don't understand the importance of wearing a mask or having the social distancing. So even taking them out to what would be a medical appointment, it becomes a difficult task for the caregivers as well, in trying to keep them as safe as possible. So I've heard an array from different people, different ages, and although I do hear that a lot of people are wanting the vaccination, it's having the access to the vaccination has definitely been something that in Imperial County, as we've seen in the news in the nation, it's something that we're struggling with. Our local public health had had a vaccination clinic last Thursday for people who are 65 and over. But that taps into those that are able to access or go to the site where the vaccination clinics were at. But then we have those, and we have many families, many with the Alzheimer's or dementia, that because of the isolation, they are alone. They are alone at home. They may not have a caregiver present at this time. And there's a lot of limitations with that in getting them to the clinics themselves. So definitely a big issue in our area.
Dr. Talavera, why don't we go back to you on this one, because I know you're the one that brought up, and I think you're right. But I think there's also that pull, because I do hear it. I mean, I hear people saying, I want to get vaccinated. I want to get vaccinated. No, I have to say what Socorro De La Torre says very true, says that, but I want to get vaccinated safely. Because they're also afraid if they go somewhere, they might get it, because a lot of people have, COVID-19 now. What can we do? What do you see, Dr. Talavera?
Well, I just wanted to comment that, the coalition that I'm working with is not so much worried about those that are willing to get the vaccine. That's a separate issue, and that's a supply and demand issue, and it's also a trustworthy thing. So that's one of the reasons that San Ysidro is hoping to get more vaccines, so they can begin to vaccinate their individuals at their home facility, rather than having to drive and wait in long lines, and with our elderly population with other diseases and so forth. But I think that I'm sorry, what was the question you were asking me? I had
you had brought up the issue that a lot of people are reluctant. They're reluctant to get the vaccine. And yet I have also heard, I tell you, from many people saying, "Donde? Where? Where can I get vaccinated? Where can I want it? Where can I get it?"
And that's
not their turn yet, so they can't. It's like, I
think it's a supply and demand right now. Everybody wants to give the vaccine. We have lots of super vaccination centers in our county, but without the vaccine to get it out there. And then the other thing is, this is where the digital divide comes in. If you're elderly or you have dementia or Alzheimer's disease, and you're trying to go to all these websites and punch in your name and refresh. That's just not part of the skill set that our older folks have. They're lucky if they have a family member that can take time to do that out of their, in the evening or something. So I think the process for getting an appointment is really tough. When we get to a situation where we have enough vaccine where you don't need an appointment, you can just go to one of these places, I think it's going to be a lot better. And then one of the strategies that San Ysidro is using is they're actually getting names of individuals and calling them to make appointments for them, because they know they are challenged and their doctor has recommended that they go through that route. So again, we got to have more vaccine, and we got to have more centers to get going with that. But we still have, there's still going to be 30-40% of individuals that are reluctant, and until individuals turn into role models for their immediate families. Like I was lucky. San Ysidro gave me one the first day they came in the door, and I called all my family. I told them, get them riled up. You got to go do it. Look, I just did it. I'm not growing another toe or anything right now, so you can do it. It's safe. And then.
Well, one of the things that I have in this bill that we're trying to pass, the large bill, is the Defense Production Act. Now, technically, we should be able to get 100 million of these vaccines. We should be able to produce 100 million a month. We're nowhere near that. And so what this does is it gives the money and also the emphasis and the push to get these vaccines, make them available, produce them, so that you don't have a supply chain problem. Because right now, you're right. I mean, you said it's a supply and demand at the moment. I mean, the demand is there. The supply is not there. And we have to get these vaccines so people can take them. Because I got to tell you, that is a principal question I get. Where? Donde? When can I get vaccinated? I'm sure that there is that 30% that doesn't want to, and they're not the ones that are approaching me. But when they see me, because a lot of people recognize me, say, "Where can I go? Why? I'm not 65 yet. I'm not." And it's when is it going to be my turn? I'm ready. And Dr. González.
I want to comment on that, Congressman. And I think I think we should maybe cut to the chase. Is I think we do have a separate and unequal healthcare system here in this country, and I think it's incumbent upon all of us to recognize this disparity in healthcare and to ensure that our communities are not overlooked. The disproportionate number of advantaged populations getting vaccinated at the loss of our community is just unjust and unfair, and for all the reasons we've talked about so far. So I think it is an unequal system, healthcare system that we are up against. And I really applaud you for your effort to get the DARPA, I think is the acronym you use, the Defense Authorization Program, to increase the supply. This is something that should have been done months ago, if I may add. And I'm happy to see that you're championing this effort. This is exactly what our country needs. But I may wish to suggest that in that act that we take some proactive steps to ensure that the communities are essential workers that we've talked about earlier, us, Latinos, maybe get to the front of the line instead of being at the back of the line all the time.
Yeah.
In fact, today we did have a conversation with the White House, and two of the people working on this saying, this is not right. I mean, the inequity that we see is unright, is not right. They're doing a number of things that they want to rectify. They do want to make sure that the pharmacies get it, and which is good. But I just think not just the large pharmacies. A lot of the pharmacies in our communities are not the large brand pharmacies, the smaller one. And then of course the clinics. We have to have these. These clinics have these. San Isidro is a great example. I mean, so many people trust. The clinic in San Isidro, they trust the clinic in, Barrio Logan and Logan Heights. I mean, that's where they have great trust, because that's where they've been getting their health care. They need to get the vaccines. They need to get them quickly. And the White House is listening, and they say they want to do this. They see the inequity. But how do we empower our community? I mean, that's what irks me. I mean, I've always argued that especially these immigrants are so essential. They come, they work hard, they lift up our country. They're our parents, frankly, and they're so essential. And we've always said, not we, but the larger community said, no, they're not. They're just immigrants. And now we see that, of course, they're dying to keep us alive because they're feeding us. They're doing all the things that we need. They're essential. They're the ones that are dying.
Yeah,
our community are the ones that are dying. How do we empower our community to make sure, one, that they don't die, and secondly, that they're recognized even after this for how essential they really are? Who would like to talk about that?
I'll go first, because
Yes,
we have an easy answer for you. I think the San Diego Latino Coalition, and I'll identify the members here just so you're aware, the Chicano Federation, the San Ysidro Resource Center, the South Bay Community Services, and MAC Project. All of those have joined together, by the way, with county funding. They're supported by county funding, and they have developed flyers, and they have trained in talking presentations in English and Spanish, and they've trained a army of promotoras who go around the city to grocery stores and to shopping malls, and they talk in Spanish and English to everyone in the community, but predominantly Latinos, to try and overcome some of the knowledge gaps, information on where to get tested, information on how to talk to your doctor, through video conferencing, and explaining, again, the importance of herd immunity and getting the vaccine as soon as possible, recognizing, of course, that we have a supply problem right now. So I think grassroots organizations getting together, forming a large coalition, and sharing pamphlets and brochures and information and talking points is one of the ways to empower our community, rather than it having to come from, the big county, messaging center and all of that. It's local. It's people in the community trying to empower individuals and groups in our community is one of the ways. So that's one. I'll stop there and I'll let Socorro
Well, you
add to
you,
that.
you obviously mentioned a whole bunch of heroic groups that I've worked with for many, many years that have done incredible work. And I mean, we have such confidence in them. So, I mean, yeah, I agree with you. Yeah. So who else wanted to comment on that? So did you want to comment on that for San Isidro? I mean, for Imperial County?
Sure. Exactly like Dr. Talavera said, I think their use of the promotores reaching out to the community instead of having the community come to the center. That's such an important way of providing the education that's so much needed in our community. As we're having these conversations, I'm thinking about our farm workers who get up very early in the morning and start working before most of us get up for our day's work. And then they come home after all the clinics are closed. So looking at them for access is, when will the clinics be available for them? If they do take a day off, that's less money that they can bring home and be able to, pay their rent, pay their utilities, and feed the family. So definitely, I think that as a community, we need to look at alternative ways to reach out to our farm laborers, and having clinics specially designed for hours that there are available for them. And I know locally in our Imperial County, there is information, but again, it ties back to the technology and the availability of that information to those in the community, knowing where to access the information. And if you have a computer, great, but if you don't have a computer, if you don't have the awareness for technology, as many of our elderly families or elderly individuals don't have, it really creates another set of barriers there.
And also, I mean, some of the farm workers now too, if you look at their age, I mean, I'm always impressed, how aged some of them have gotten. Of course, our immigration system's broken, so we haven't had the ability to replace people. And some of them, I'm sure, would like to take a break from working, but they're still working, and they're aged now. I mean, they're older. And very, very difficult. And I have to say too, I mean, and I've heard this from so many people, that a lot of the farm workers don't get the PPE that they're needed. They don't have the distancing. They don't have the sanitary. All these things are very negatively impacting this group of people.
Yes.
Dr. González, you were going to say something.
Oh, no, I was going to comment on what Socorro had just said, is that you've worked all day, you're tired, you're a little older too, and maybe even more tired. And I think this bespeaks another opportunity is you can build the infrastructure to take instead of them coming to the vaccine coming to them at the work site.
Exactly.
And I know this model's been used, and perhaps that's another opportunity to take the infrastructure to the street where people are working. Certainly will make a difference in making it less onerous a task to do that extra thing to get vaccinated. Is that because this is so essential to our nation, our community, is that it should be taken to them and make it as easy as possible, accessible as possible, so that we get above and beyond. I think everybody getting vaccinated is really the goal, not 70%, if I may. I think the work of the coalition sounds outstanding. I think the Promotora model is the model to use. And I would also include in that as well is our faith leaders with whom the community doesn't trust. Is that at every pulpit that the message go out that this is good for our community. We all want to get to heaven someday, but let's not rush it.
And I think, Hector, you mentioned a very important point. This is not a one-time project here. I think the channels of communication and the network that the Latino Coalition is putting together has to stay intact, because we now are going to have to be dealing with the issue of the variants, which may or may not take over as the dominant organism in our communities. But also it's going to be hard to explain to people who got 2 shots why they might have to go back for a booster, because a new variant has emerged in our community, and trying to explain that and where to go and how to get it. And and those kinds of things. And then, yeah, and then just simply returning back to normal life. I'm still waiting for direction on when can I travel again to go see my family on a plane. You know, I'm hearing different things right now that it's safe or it's not safe, and how it, you know, being now vaccinated, it might be a little safer, but how much safer? So there's so much information to get to our communities and improve their quality of life soon too, because I'm sure they want to get back to their family gatherings. And before we know it, Christmas and those holidays will be upon us, and we want to make sure we get the right information out and don't suffer more than we have to.
You know, a couple things I guess I would mention here now. Then, you know, one of the things that you said, you know, bringing the vaccine to the people. The White House, of course, is talking about the National Guard. They're talking about the military. I think that's great. But I also brought up, and a number of people did in the CHC, the Congressional Hispanic Caucus, that we need mobile centers. And I think that's one of the things that you were talking about, bringing the vaccines actually to the people. I mean, that would be, I think, very, very helpful to do. And they say that they're definitely going to look at that. But one of the things that you brought up, Dr. Talavera, maybe we could talk a little bit, and it's not totally a field from the medical aspect, but, you know, the social aspect and also the economic aspect. I mean, so many unemployed, so many in our community that are underemployed or unemployed or who are undocumented and haven't been able to get the health and the resources that they need, even though, you know, we've been fighting for that. And we're going to do a little bit better under Biden, I'm hoping, but still not, you know, total equity. But why don't we talk a little bit about it? We have 10 million people that are unemployed. You know, we have you know, this huge problem. We're trying to address this also in the American Rescue Plan, and yet it seems like so many in our community don't get that help at the end of the day. You know, you have these mixed families where you have a child who's an American citizen, and you have a parent who may be undocumented, and then all of a sudden, you know, this child doesn't get what this child needs and deserves, and frankly, the parent too.
Yeah.
Would anyone like to comment on that?
Well, I can do some of that. I think the federally qualified community health center network across the country, which serves, I believe, 5 million people, they are largely uninsured and underinsured, are fulfilling that public health pledge by not caring whether or not you have insurance or whether you're documented. They just look at it as people in the community. It's a public health necessity to treat and care for them health-wise, including the vaccination. So I'm sure that the health centers across the country, and there's not enough of them, of course, but they will do their part to reduce the burden on the uninsured and the underinsured in terms of gaining medical access and getting to the vaccine and getting good information. So that's one way to do it, because the private and even the nonprofit organizations, they still have a bottom line of trying to, you know, make some money. A lot of them are stepping forward, like UCSD. I think they're administering vaccines to anyone in the community, so that's good. So I think people don't realize all the time the public health infrastructure that we have in the United States and what it's for. So this is a perfect example to highlight that.
If I may comment,
yes,
firstly, Congressman, I think the idea of a mobile unit is outstanding, and I certainly, if I may recommend, maybe not staff it with guardsmen or ICE agents, for example. But I want to step back a little bit here, and something that Greg was touching on, and that is, look, and I think it's been said before, but the COVID disparities that are impacting our communities are terrible, undeniably. And that's why we're here today, to make sure that this is even more highlighted in the community. But I will add that these are nothing new. These disparities in healthcare have been going on for a long time. This is just the spark that has ignited the fire that is highlighting the disparities in our communities. So gosh, let's get this thing under control, please. This is desperate. And then I would say, but the job isn't over until we have some healthcare equity here in this country and in your district and throughout California. We live in a very prosperous state. And I'm very proud to be a Californian. However, we really need to step up and show what a great state we are and ensuring that everybody is adequately covered, everybody has equal access to care, and that if, God forbid, the next COVID pandemic or whatever pandemic's coming down the way, and they will come, I'm sorry to say, is that we prepare now. I mentioned some of these medical health conditions like the diabetes that affect so many of us. This is just a symptom of something that's larger and that truly needs to be addressed, so we don't have these disproportionate impacts of pandemics or whatever's next down the line. We're a strong nation. We're a great state. And to that end, we have some responsibilities to live up to ensure that equity is the norm.
I totally agree. Socorro, I want to make sure you get a chance. I know you were agreeing with them, and I know Imperial County suffers from the same thing that San Diego County suffers from, this great inequality, this great inequity, disproportionate effects.
As I'm hearing the conversations, the comments by Dr. González and Talavera, it's like I'm thinking of all the families, of all the individuals that I know, and how they are defined. Well, what the conversation brings them to mind, all the issues, all the concerns that they brought to me, whether it be as a friend or as a social worker. And a lot of them, with our farm workers and their families and the people that don't have documentation. I know one of the barriers has been, again, the fear of identifying themselves to any agency, whether it's a clinic or a government, as someone who does not have documents. And that fear of being identified in some aspect through the internet, through the databases, that they'll be, deported. So that's something that I've had conversations with a few, and that again is another barrier. It's coming back to the immigration status. It's a barrier for them accessing the services, the fear of being identified and being sought out. So clearly, like everybody's saying, this has impacted everybody, our Latino community. And COVID is just making it more salient, perhaps, to where issues are now arising. And because of COVID, we're able to identify more what has always been there, and trying to address these issues. I do believe it takes the community. It takes a state, a country, to a nation to be able to work through these inequities and hopefully find a solution soon.
Now, I know we're going to have to come to an end here soon, but I don't know, Dr. González, you were playing to the crowd here. I don't know if you know, I studied to be a priest for a long time. I was a Jesuit. And in fact, I was in El Salvador for part of the war and sadly saw many people die and buried many people. It's always a tragedy. It's always horrible for the families when someone's life is cut short, and when the family's not there, to give, healing, not only for the person who's dying, but also for themselves, frankly. But I always do see hope on the horizon. I do always think that at the end of the day, good will win, that we'll defeat this terrible pandemic, that somehow we'll come together, and that I'm hopeful that, we have this proposal for, a comprehensive immigration reform package that we give 12 million people really the love and the equality that they deserve as our fellow brothers and sisters. And so I'm also excited about that. But at the moment, we're in this fight. I mean, we're in the fight to beat this pandemic, and we're in the fight also to see that there's some equity, because we see the disproportionate impact that we have in our community, not only our community, but our poor communities too, the African American, the Native American community's been completely devastated. I mean, and so we fight together to say, if we really are a good country, which I think we are, let's come together and fix this. You know, we have to fix this. And I don't know, maybe something has changed in the last 27 days, but I feel much more hopeful.
I share that hope, Congressman. And as a fellow Jesuit, I think the mission is very clear for justice, social justice. And my best wishes on your great task to ensure that we do have some justice.
Yeah. And I do want to give you the last word here. Again, I want to thank you profoundly for coming on. I think that we need to do more and more information, give more information to our community, continue the fight that we're in. I mean, so many of the groups that you mentioned, Dr. Talavera, you know, champions in our community, you know, but there's many, many more, you know, in Imperial County and also throughout San Diego. You know, we have to stay in this fight. But anyway, I'll give you the opportunity to close. Anyone that would like to say a few words, please do. I'll give you the opportunity now.
If I may, I think the words that resound in my head are that nobody's safe until we're all safe. And so that's the way pandemics work. And until we're all safe, rich, poor, black, white, brown, this pandemic will continue and it will mutate. So it's all the more important to be, and this goes globally, but here at home, that equity is going to make us a stronger nation, a healthier nation, one that survives.
Very well said. Anyone else? Dr. Talavera?
Well, just quickly, I think, you know, although we were focused on the Latino community, I agree with you, Congressman, that we have to work with our fellow brothers and sisters of, you know, all the disadvantaged communities to survive this this virus and to work towards, you know, equities and other dimensions of our lives like housing and transportation and workforce. So I applaud you, and I know you're doing this, but you've got to support those funding for the FQHCs.
Absolutely, totally. I couldn't agree with you more. Socorro, the last word goes to you.
Well, I just want to thank you, and definitely this is work. We have a lot of work ahead of us as we continue to work hand in hand with our neighbors, with everybody in our community, and helping with the information, resources, whatever it may be at our hands, to help those immediately close to us and kind of have that ripple effect as we reach and we extend throughout our community. And then thank you so much for all you do in helping us with the what is it, the act, I wrote it down here. I don't have it with me.
The American Rescue Plan.
And that one.
Defense Production Act.
Yes, thank you so much. We definitely need that, and I too feel so much lighter for the past 27 days or so. Thank you.
Well, again, I want to thank all three of you, a very distinguished panel, Dr. Gregory Talavera, Dr. Hector González, and for Socorro De La Torre. Thank you very much for empowering our community. That's all for us today. And again, thank you. God bless all of you.
Okay.
Igualmente.
Gracias.
Take care.